Welcome, Dr. Phakula, on this interview. How are you doing?
I'm well, thank you. Thanks for having me.
I'm all right. Thank you so much for an opportunity to have this conversation with you. Can you tell us who you are and why did you choose general surgery as a field of speciality?
I'm Dr. Phakula, a graduate of the University of Limpopo, formerly Medusa. I specialized in general surgery because I just love the craft. I just love, working, being hands-on with patient care. And I found surgery to be quite an interesting discipline because, you get to see the results of what it is that you are doing, and you get patients really appreciate, and you also it gives you that sense of satisfaction, having seen the outcome of you assisting the patient getting better. Eventually, yeah, that's basically it.
All right. What are some of the biggest challenges that you face as a general surgeon in general?
Well, the biggest challenge, I would say, it's with regards to being in practice. Sometimes you get patients who come in with expectations which you are not able to meet as a surgeon, and also in terms of practice as well, challenges becomes now also. If you're in private practice, when you try to balance work-life, trying to balance, running the practice as a business, and making sure that everything works out smoothly. That's one of the biggest challenges that one comes across.
Dr. Phakula, how do you stay current with the advancement in surgical techniques and practice?
So, in trying to remain relevant in the discipline of surgery or any other field, one has to interact with colleagues and peers all over the world, where you get to present, you get to look at latest research and attend some of the conferences that are out there for the surgical practices. There's quite a lot of them going around, and also in addition to presentations and attending these things of conference and whatnot, you also have to advance your studies, beyond the basic degree or beyond the basic qualification. You can do other things as well, and also put your name out there so that you are known and you keep current with what everyone else is doing. So that could include research, it could include, like I said, presentations, it could include taking exams both locally and internationally if the opportunity arises.
Now we're going to switch gears and start talking about your practice with your partner. We're able to get privileged to interview your practice manager a few weeks ago, and she told us some very interesting insights when it comes to your space. Now tell me, have you seen any impact in terms of service delivery and profitability when it comes to your practice, since you guys have a nice structure?
Yes, I think the input from your practice has really helped us a lot. I think now things are better streamlined in terms of who's responsible for what, and how we follow up on the value chain, if I may call it that. And the profitability definitely is there, and I think if you had spoken to the practice manager, she would have told you that what we've experienced, from before you came in and after you've came in, all the changes and all the improvements which are there. And yeah, most definitely there has been a lot of improvement.
And obviously in this structure, you guys are working hand in hand with the practice manager to support her, I assume?
Yes, we support as much as possible. And I think, there's always room for improvement, and over time, I think we've gotten better. Experience is, of course, is what teaches us in where to improve, where to change things and all that. But yeah, definitely we try and support each other, and there has been that improvement over time. and we are moving forward in a direction where we can only improve better than what we are doing currently.
Okay. And if there was a student who is maybe studying medicine and they want to now branch into general surgery space, what would be your advice for them?
Look, surgery is one discipline that you must have the love and passion for it, more like any other discipline anyway. So if you have the love and passion for it, I mean, it's very easy, if I may call it that, to be a surgeon if you are committed, if you are dedicated. You just need to follow the path, and once you are in, definitely you will have that satisfaction that you are looking for as a clinician and as somebody who's treating patients. So if there is anyone who wants to be a surgeon, I would say definitely go for it. It's the way to go.
In closing, can you tell us what exactly is laparoscopic procedure?
Well, laparoscopy is basically, simple term is called minimally invasive surgery, and in layman's terms some call it keyhole surgery. It's basically where you do surgical procedures inside the abdomen without using the traditional way or the olden way of having to make a big cut in the abdomen. So now you make small little cuts, 3, 4, 5, whatever the case may be, and then you work through small instruments and you manage to do a bigger procedure through very small openings. And it has got advantages of shortened healing time. It's got less pain. Patients tend to return back to function a lot earlier than those who have traditional open surgery. So that's the biggest advantage of laparoscopic surgery.
It sounds very interesting. I wish there could be something like that for C-section delivery.
Yeah, well, with technology and AI,
yeah, that would be better, because you know that this is something else. But I really appreciate you taking the time for doing this interview with us. Thank you so much for this opportunity.
Thank you.